So first off, we need to define death. There's two main schools of thought. So we've got irreversible cessation, stopping of all blood circulation. So heart stops beating, or there's no blood to circulate. The other one is cessation, stopping of all brain activity. So sometimes we see, people with legal disputes over whether or not a person should be kept alive in a coma. If you've got no brain activity, people who are in the second camp would say, hey, that person's passed away. People in the first camp would disagree. So when we talk about pathology, oftentimes we want to talk about an autopsy. Now, an autopsy is going to be conducted by a pathologist or a medical examiner or a coroner. The reasons to have an autopsy. So not everyone has an autopsy when they die, but if the cause of death, time of death, or if there's been foul play, so a weapon, if there's any reason to think that there might be a homicide or a suicide, there'll be an autopsy. If the person is unidentified, so if it's a John or Jane Doe, there'll be an autopsy. If there is some pre-existing condition that may have had an effect that matters for legal reasons, there's going to be an autopsy. But autopsies are fairly rare. Not everyone who dies is going to get an autopsy. So when we talk about autopsies, we want to discuss the manner of death. So how does the death come about? This gets broken down into 5 different categories: natural, accidental, suicidal, homicidal, and undetermined. The last 3 are going to be the most interesting to us forensically. So natural would be, cessation of bodily functions because of old age or disease. So, grandma passes away, that's a natural death. Accidental is an unplanned event, so car accidents, slip and fall in the shower, accidental. Suicidal, individual purposefully kills themselves. Homicidal, somebody else kills the individual. And undetermined, there's no evidence to really figure out what happened to that individual. So here's some sample questions. Pause the video real quick, read them. Okay. So in the first one, the man has an underlying heart condition, and it's that heart condition that kills him, but it would not have presented itself without the attack. So the manner of death would be ruled a homicide, because it's not a natural death. The man would have been fine, would have lived for who knows how long. It's the death, or it's the attack that causes it. In the second one, she dies of natural causes, and she doesn't get the nurturing she needs. But if you don't feed your mother, that's homicide, dude. Feed your mom. Just good to you. Cause of death is the reason someone died. So there's many more causes of death than manners of death. So, and then we've got approximate causes of death, which are underlying reasons. So causes of death would be diseases, injuries, heart attacks, stabbing, shooting, drowning, hanging. All of those things would be the reason that somebody died. Mechanism of death is the specific changes that brought about the end of life. So if we have somebody who is shot, the mechanism would be loss of blood, manner of death would be homicidal, cause of death would be shooting. If we have somebody who has a heart attack, the mechanism of death would be the heart stops beating, manner of death would be natural, cause of death would be a heart attack. So if you had massive trauma to the body leading to pulmonary arrest, that would be Pulmonary arrest means heart stops beating. But massive trauma to the body means cause of death could be accidental. Or the manner of death would be accidental. Cause of death would be the trauma. We also want to discuss antemortem versus postmortem injuries. So ante is a prefix that just means before, post obviously is after. So we've got 3 different types of injuries: antemortem that happens before death, perimortem that happens at the time of death, and then postmortem that happens after death. So real quick, pause it, read the slide. So the pedestrian has the cut on the arm. It's not going to lead to death because it's just a cut. And since that happened before the accident, that'd be antemortem. The massive head trauma that happens during the death is going to be perimortem. And then the fact that somebody then drove over the body would be postmortem injuries. Now, we can, we'll talk about later how we can actually tell if injuries happened: perimortem, postmortem, antemortem. But antemortem injuries are mainly going to have signs of healing. Postmortem, it's going to be obvious that the body functions have stopped. So injuries that cause death. Antemortem injuries bleed and gape. Postmortem injuries show less blood and don't gape. So postmortem injuries, if rigor mortis is set in, if the heart has stopped beating, obviously if the heart stops beating, there's going to be less blood coming out. If the flesh is, starting to undergo rigor mortis, it's not going to gape as much. For asphyxia, so if there's insufficient oxygen, you asphyxiate. In strangulation, the heart and veins are enlarged. In drowning, it's the larynx that enlarges. Smothering, so hold something over somebody's face, you'll get bruises on the lips, contusions on the lips. If we're talking about bullet wounds, we can look at how much the tissue is affected. The higher energy bullets are going to cause more damage than lower velocity bullets. Entry wounds smaller than exit wounds. Typically, powder burns are going to happen if the muzzle of the gun was near the victim. For stabbings, we can look at slash marks, whether or not there was hesitation between stabs. Incisions, puncture wounds. So, time of death. Not all the cells in the body die at the same time. It can take several hours for all of the cells to get on board. Picture the chicken with its head cut off. Well, chickens have a little bit of extra nervous system in their back, but basically, just because the head dies doesn't mean the rest of the body has to. After death, the heart stops beating. No longer are we getting oxygen. When we talk about algor mortis, that's the temperature change that a body undergoes after it's passed away. So, just like anything else, if you leave your coffee out and it's nice and hot, a couple hours later, it's going to be down to room temperature, right? Same thing's going to happen to a body. So, the body's going to cool until it reaches the same temperature as its environment. Um, every room is room temperature, right? Anyways, so the average temperature drops for the first 12 hours of death. The body drops about 1.4 degrees Fahrenheit or 0.78 degrees Celsius. After 12 hours, it's about half that, so 0.7 degrees Fahrenheit or 0.39 degrees Celsius. Now, in actuality, it's going to be an exponential decay type curve, but we're just going to estimate it. Obviously, if it's a hotter room or hotter outside, the temperature is going to decrease slower. If it's colder or if it's windier, you lose that heat faster, just like if you were still alive. Excess body fat means the heat's going to be lost slower. More clothes, you lose the heat slower. If you have absolutely no clothes, you lose the heat faster. So a naked, skinny person out in a cold, rainy day is going to lose heat a lot faster than a person wearing a parka who's morbidly obese sitting out in the hot sun. Makes sense. The next one that we can talk about is livor mortis, the color change that happens after death. So the blood starts settling, leading to what we call lividity, the discoloration, and the pooling of blood. So blood vessels, the tissues break down, the blood just seeps down to the lowest place it can be. The hemoglobin turns purple. So hemoglobin is the molecule that turns red in contact with air or in contact with oxygen, and really it's there to move oxygen around your body. That's going to turn purple and start discoloring. It begins 15 to 20 minutes after you're dead. It's obvious 1 to 2 hours after death, but that color change will disappear if you press the skin. So when you're pressing the skin, basically you're pushing the discolored blood out of that area, and then the discoloration is fixed within 4 to 6 hours after death. So livor mortis can be used to indicate the position of the body and estimate the time of death. So, if this, I believe that's a gentleman, was found with livor mortis on his back, if he's found face down, well, somebody moved the body 4 to 6 hours after he passed away. Stage 3 is rigor mortis. So I feel like rigor mortis is, one of these things that's kind of entered the collective consciousness, right? Basically what happens is a loss of oxygen in the muscles and changes in calcium and lactic acids make the muscles tense up and this corpse stiffens. It starts in your facial muscles 2 to 3 hours after death. Complete rigor mortis occurs in about 12 to 24 hours. So, in about a weekend at Bernie's. Stiffness is going to begin to leave the body after 36 hours, and it's going to kind of go in reverse. So the small facial muscles are going to unstiffen first, and then the larger muscles of the body are going to stay stiff. If there's more clothes, higher temperature, illness, or exercise, these can all increase the rate that rigor mortis sets in. So exercise, if you've ever exercised to the point that you start cramping, that's due to a lack of lactic acid, or a buildup of lactic acid, If you have more lactic acid because you're exercising, that's going to make rigor mortis set in sooner. Higher body weights are going to decrease the rate of rigor. This is just kind of time of death, when rigor mortis events happen. Pause it if you need to read that. Other things that happen after death is your body stops digesting food. So by using that, we can figure out when the last time a person ate was. If there's undigested food in the stomach, that means it's been 0 to 2 hours after their last meal. So we can use that to estimate time of death. If the stomach's empty, but you have food in the small intestine, that means you've got 4 to 6 hours after a meal. If the small intestine's empty, but you have waste in the large intestine, then that's been 12 hours since a meal. Your eyes will build up a film. If they're open, it builds up quicker, 2 to 3 hours after the death. If they're closed, it can take up to 24. There's a whole lot we can talk about with insects being attracted to. We'll talk about that in its own thing later, and also soon. When we talk about a body's decomposition, there's 6 different stages to that. And like everything, it's going to vary from person to person and, situation to situation. But the most important factors are going to be the temperature outside, or the temperature of the environment. If there's accessibility by insects, so, a body in the woods is going to be broken down differently than a body in Antarctica, and depth of burial. Insects are going to arrive and develop in predictable stages. We'll talk about that on Wednesday. So, University of Tennessee has a program that they call the Body Farm. Bill Bass founded this in 1980, and basically what they do is they have people who donate their body to basically be used to understand the processes of post-mortem decay. So we're going to look at a pig because it's, even though it's a little baby pig, like Babe Pig in the City, it's a lot less freaky to look at than a human body. So we've got early post-mortem decay, which happens within the first 2 days of death. Bacteria and the body's own digestive enzymes start breaking down the body. You get blisters, you've got lividity, insects and microorganisms. So without the autoimmune system kicking in, the bacteria present in the body just kind of go wild. And then you have autolysis. Basically, as these things are broken down, gases are being produced. So you get some gas and some bloating. So putrefaction is about 2 days after death. Many more insects. The odor, there'll be a color change from red to green as your red blood cells decompose. The bloating from gas builds up. So if you've ever seen deer that got hit by the side of the road and no one's stopped to take it to wherever you take those things, the legs will be splayed as the body cavity is basically blowed up, right? And then the tongue, face, and neck will swell on a person. That's going to make actually looking at the body and saying who they are difficult. After that, we've got black putrefaction. That's 6 to 10 days after death. The flesh starts to turn black. Hair, nails, teeth fall out. The skin slips away. And basically, the tissues are liquefying, so there's more fluids, very strong odor. The body cavities collapse in on themselves. Hope you weren't eating during this. Butyric fermentations, 20 to 50 days after death. Beetles start to visit the corpse. Once again, we'll talk about entomology a bunch later. The body begins to dry out, so all the flesh is liquefied. What's left is kind of dry. Butyric acid forms and makes a cheesy smell, which attracts cheese skipper flies to the body. Dry decay is after 50 days. The hair and the bones are pretty much all that's left. Moths will come and feed on leftover hair And then skeletonization is going to vary, but it's usually more than 50 days. At that point, there's only bones left. If we're taking a look at the bones, so green bones are more recent. They feel greasy to the touch. Bleached bones have been left out in the sun. If the bones are stained and dark, then they've been buried in the ground. Cracking means that they've been exposed to a freeze-thaw cycle. So, chemistry of death, there's predictable changes that are going to occur as the compounds inside the body are broken down. And we can test those and figure out the time of death pattern and get a good estimate.